going to get right into it. So let's talk about it. So it's a lot of misinformation and myths that can be spread through our communities. Currently, can you give us a quick understanding of how a vaccine is made, or this particular vaccine was made?
So a lot of people talk about the time frame for this vaccine, and the reality is that it is one of the most studied vaccines compared to any time in the world. Why do I say that? It's because you had every scientist in the world focused on this one vaccine. You never get that opportunity. And the way vaccines are evaluated is, I'll take it back to when everybody was in elementary school, scientific method. You have you're at the bench, you have a question, you evaluate the data, and you apply a trial. One of the strongest types of trials is something called a randomized control trial. So you randomly put one group gets an intervention, another group might not, and you see how the therapy affects each of those groups. And you have the best scientists in the world evaluating those vaccines. So the only thing different was that Moderna and Pfizer are mRNA vaccines.
Are what?
mRNA vaccines.
Means?
Which is...
messenger vaccines, right?
Yeah, messenger vaccines. So what they do is they'll make the proteins that prepare your immune system to fight the virus, right? So it will make a small portion called a spike protein so that your body can identify it, and then when it comes to reach that again, it's prepared. Just like any other sickness that you probably got, your immune system was prepared. But this was a novel virus, so that's why we need a vaccine to help expose our immune system to be able to fight that virus in the future and make sure that you're healthy and you're not necessarily as sick as you could be if it was new.
So I got another one for you. Can you give us a current snapshot of the stats and the impact of COVID-19 in our community?
Yeah, so generally speaking, the amount of people that are vaccinated, so in Illinois, roughly around 13% African American. The numbers are relatively consistent, around 9%.
9% that are currently vaccinated?
Of those that are vaccinated.
Okay.
So when you dive deeper into that, men are less likely to pursue the healthcare system. And if they are going to pursue the healthcare system, it's usually because their mother or their wife is in their ear or encouraging them. So that's why.
Absolutely. Facts.
So that's why. So oftentimes when we're trying to partner with people, we're either making a family event because we know that sometimes the wife or the mother's going to bring them. But sometimes we'll go straight for like alphas, barbers, and things like that to make sure that we can engage our community appropriately and lead by example.
You're mentioning that and how essentially for us to go to the doctor, our girl or mama or somebody got to make us bring. But in addition to that, why is there such a health disparity in the Black and brown communities?
I think that's a loaded question because it's multifactorial. And I think every person that was studying this stuff, every person that was studying public health knew that the marginalized were going to be the first to be affected. And when you think about the day-to-day, who has space and who doesn't, right, during a pandemic. If you live in a tight space, you got 4 family members in a tight space, you're just more likely to contract the disease. The people who are most likely to get sick and die is age. So that's why we really focused on the elderly. Right now in Illinois, more than 80% of the elderly are vaccinated.
Doc, I remember when they sent us off. Remember when it first came out, and they made it seem like it was something that black people couldn't get? Next thing we knew, it was affecting us. You know what I'm saying? Like powerfully.
When you look at the first wave in April last year, it was 70% of the mortality, 70% of the deaths were Black community.
Why is that the case?
And then, that's what I'm. So when you talk about social determinants of health, who's getting chronic, who has chronic diseases, who's obese, who is sicker than others, it is more represented in our community, but that's not the primary reason why that's happening. You have to think about how healthcare is given, how hard it is to get access to good healthcare, food deserts, who has access to healthy foods and things of that nature. And the summation of all of that puts people in a very precarious position. And so one of the hardest things to tell people that if you look at the groups who's getting COVID right now is 18 to 39, and they feel invincible. If you're young, if you're young and healthy, it's true. You might just have a fever and you'll get over it. But the reality is that it affects further than you, right? It's your grandmother, it's the leaders in your community that are older and more vulnerable. But we are doing a decent job at vaccinating our elderly. And when you look at the hospital rates, and today there was only 248 positives. Like, that's vaccine, that's science. You know what I'm saying? Everybody's vested in this. Like, you know, anybody that got a business, that got a company, needs to be vested in this. And it's one of those unique situations where that you can't really deny that.